Hi, everyone. Welcome back to the afternoon session. Super excited to kick off the second part of the DeSci Summit, where we're going to be going more into the use cases of DeSci, and we're going to learn about some really cool DAOs in bio right now. So to kick off this session, we're going to have Paul, the co-founder and CEO of Molecule, come and give a keynote about why this is all important.
There we go. Cool. Hi, everyone. Really excited to be here today, and I think give the first proper talk of the day. We had some amazing panels in the morning, and the goal of my talk is really to showcase a little bit like what's happening in DeSci under the hood, and then also remind everyone why we're here again, because I think looking at the examples makes that much more concrete. Thanks so much for the intro as well. I'm Paul Kohlhaas, CEO and founder of Bio and Molecule. And so why are many of us in crypto, if you're in crypto? So fundamentally, I think we invest into crypto because we believe in sovereignty, in kind of liberty, in open source access to information and data, and in freedom of speech. And because something is being taken from us slowly and silently. And what do I mean with that? With that, I really mean kind of the massive inflation that kind of we've seen over the last couple of years, money printing by central banks across the globe to kind of save oftentimes failing banking system. And so Bitcoin was created as an alternative to that, right? To kind of replace the Fed. And science and medicine, in my view, are kind of fundamentally trapped in the same power structures, kind of the powers that be. And what are those? It's kind of the biopharmaceutical industry, kind of the mega complex that produces medicine, and then the patent system. And they're kind of like deemed too big to change, just as kind of the Federal Reserve was once deemed too big to change. I think Balaji famously said this, that like someone had to invent Bitcoin for actually people to begin questioning that system. And I think DeSci really aims to do a similar thing. So biopharma, like medicine in the US, healthcare spending consumes 18.5% of US GDP. Around 9% goes directly to the sale of drugs and pharmaceuticals. And that's an insanely high number. Like, I fundamentally posit that we could be spending much less on healthcare, have much more diverse treatments, and have healthier societies. We could be spending that money on other things like education, infrastructure, and this entire system is entrenched by a 19th century era patent system. So in our current system, treatments and recurring revenue fundamentally dominate healthcare. The system that we've created to date needs lifelong customers, and it disincentivizes cures. This leads to the chart, for instance, that we see on the right, which is the rise in US overdose deaths involving prescription opioids. In some cases, in some years, there's 16,000 deaths annually from opioids that are kind of that are given out by the medical system. On the other hand, Goldman Sachs asked in a famous article, is curing patients a sustainable business model? And this article analyzed a novel hepatitis C drug that was put onto the market, and previous treatments for hepatitis C basically made more revenue than this cure. And Goldman Sachs says, well, you guys really shot yourself in the foot. You're kind of destroying your customer base. You made more money before, and like we ran the numbers on it. And based on that, they downgraded the company, and executives at the time were fired because they developed a cure. On the other hand, scientists spend 80% of their time applying for funding and around 20% doing the science. That's really the numbers that we see, and probably many biotech founders or scientists in the audience can probably confirm that. Our fundamental hypothesis is that most of the world's potential scientific talent remains untapped, and that we live in a time of science friction, not of science fiction. This is a really interesting case. There was a scientist who treated her own cancer with viruses that she grew in a lab. This happened in Q4 last year. It ultimately led to a Nature article, though, how this scientist called Halsey self-administered a treatment called oncolytic virotherapy to help treat her own stage 3 breast cancer. And she's now been cancer-free for 4 years. But then the article says, in choosing to self-experiment, Halsey joins a long line of scientists who have participated in this under-the-radar, stigmatized, and ethically flawed practice. So she couldn't get anyone to even publish this for over 3 years until one editor decided, actually, I'm going to go against the stream and publicize this. And then I found this tweet really funny. Scientist does science, cures cancer. The science establishment, no, you can't do that. And then we wonder why scientists are fleeing academia. So what do we ultimately need to really, I think, move humanity forward? We need permissionless science. And so we're coming at this problem from 2 sides. I just mentioned the intellectual property system. We'll hear a talk from Molecule later. Molecule is really an exchange for on-chain scientific IP, and we turn siloed research into kind of liquid open markets that are powered by data. And then on the other side, you probably heard a lot about Bio. Bio is a curation and liquidity launchpad for scientific communities. We bridge DeFi and DeSci together and help scientists, patients, and investors collaborate on-chain to fund real-world research and kind of commercialize the outputs. So you probably heard a lot about BioDAOs, and this talk is also aimed at kind of giving some of the base primers on how does the ecosystem actually work. I know we have a lot of new faces here that might be hearing about DeSci for the first time. So BioDAOs really create values by building on-chain IP token portfolios that represent novel research rights in all sorts of areas. We're going to look at some of those areas just now. And these kind of new products or these research projects can later be sold to pharmaceutical companies. They can be sold to biotech companies to commercialize, or some of the DAOs are already choosing to commercialize the outputs themselves. So you have a DAO that forms. It issues a governance token. Members of the public, interested participants purchase those governance tokens and fund a treasury. The DAO then begins funding research and IP through a global community of scientists. And that IP can later be monetized with the proceeds flowing back into the treasury. This is, for instance, a case study on VitaDAO. We're going to hear a lot more about, I think, VitaDAO in the talk that follows this. But basically, you have a biotech company or a university that will give its IP rights to VitaDAO in exchange for funding. And then later, VitaDAO can give those governance rights on to different IP token holders, again, receiving funding. This is kind of a brief overview of VitaDAO's current IP portfolio. It's taken VitaDAO about 3.5 years, or like 3 years, to build this portfolio. We'll look at some of the big outlier success cases here in a minute. So let's take a view outside of VitaDAO. So VitaDAO forms a part of this much larger bioprotocol ecosystem that we've been developing. These are some of the metrics that we've been tracking. So in total, the research funding that has been raised by BioDAOs to date is over 30 million. The BioDAO community size today is around 110,000 people globally. We have over almost 30,000 token nodes in our ecosystem, and the total value of tokenized IP currently sits at 11.5 million. I think it was almost 50 million in December. So the market moves together with the broader crypto market. It fluctuates. And this is actually something that I think Jane and a couple of other people previously have said. This is one of the biggest challenges I see for DeSci, is like, how do we bridge the cyclicality of the crypto market and kind of the broader economy with these long-term research outputs that we're trying to create. So since I last stood here about a year ago, the DeSci ecosystem has grown really significantly. Some of the newest DAOs that just launched, one is Curetopia. I think we'll have a talk from Ethan in a bit. Another one is a DAO focused on quantum biology that recently launched. And the leading ones are still VitaDAO and HairDAO. Big shout out here to HairDAO. I think HairDAO is an incredible success story. They funded a piece of research in beginning of 2023 through an IP-NFT. They then organized a decentralized clinical trial with participants in their Discord. Together with the University of Miami, people could sign up for the trial, and this particular substance was a repurposed thyroid hormone. And at the beginning of this year, they began selling it through an online store. You can go onto it, you can check it out, anagen.xyz. And I think the preliminary data, don't quote me on this, maybe they'll correct me online, is that it's 3 to 5 times more efficient than the closest hair loss product on the market in regrowing hair follicles. And so I think this is an incredible outcome for DeSci. within 2 years to go from a novel product that is researched, repurposed, and is now being sold to consumers in the US. So BioDAOs are launching all the time, which is really, really amazing now. I'm eternally grateful to the whole Bio community and kind of all of our supporters, our entire team, for enabling these entrepreneurs to launch just continuously. So Quantum BioDAO launched in December, raised almost 6.9 million. Just now opened their first quantum biology lab in LA. They're building a quantum microscope. Really, really incredible community, and I think some of the most avant-garde research that is being done. They launched, Clarice D'Aiello, the founder, came out of MIT and is working with some of the best scientists in her field. Then Rowan Dixit, who launched Long COVID Labs, raised around 2 million, over 500% of the initial funding target hit. And I'll talk in a minute. I'll just give an example of like what they're currently working on, and then we'll hear from Ethan with Qtopia in a little bit. They raised, I think now it's 2 million because the price of Sol has increased, to focus on rare disease research. And I'll show some progress here from the lab. So this was actually this week. So no, last week the first patient in one of their studies got his pre-treatment blood work done. So they send kind of a mobile physician to a patient's home to kind of collect a live sample. Many of these patients actually are unable to leave their home, so it's very difficult for them to seek treatment or for anyone to even collect data on long COVID. Long COVID is estimated that it affects about 200 to 300 million people globally. And there's very little hope actually for these patients. It often affects young people. You have very strong online communities, self-help groups. But I think it's one of these huge success cases for DeSci. You also see Long COVID Labs has about 6,000 followers. And so this post that they did got 46,000 impressions and over 700 likes. And I think that's incredible because this actually will get much more of the general public, of patients, to pay attention to what's happening in crypto and onboard a fundamentally new type of user. And then just 8 hours ago, patient number 1 received their Pemgarda and Paxlovid repurposed drug cocktail. So they're actually, this DAO launched 2 months ago, and now they're starting to treat patients with a novel repurposed drug cocktail. I think that's really incredible. Yeah. So what are we fundamentally enabling now? What phase is DeSci in? What are we moving to? So we launched the new Bio Launchpad on Base and on Solana in, I think, about a month ago now. And the Launchpad is really, the goal of this Launchpad is to bring this number of currently 9 BioDAOs to, I think we have 6, 7 now that are actively in curation, 2 are currently fundraising, but really massively broaden the funnel. Because the liquidity in crypto is there. And it's not just about liquidity, it's fundamentally about empowering kind of a new era of biotech founders, scientists, and scientific communities. So I'll talk very briefly about how does this Launchpad work. You may have seen other Launchpads, like I think Pump Fund is on the one side of spectrum of Launchpads. And then another spectrum, for instance, is Virtual's protocol that actually serves the launch of AI agents through Launchpad infrastructure. The Bio Launchpad works in three pretty simple ways. First, you have curation. So Bio token holders can decide which DAOs actually get listed on Bio protocol. Then there's a funding stage where founders and kind of the ecosystem and community have a governance vote whether a DAO should launch on a bonding curve, which is one type of fundraising and price discovery mechanism, or do a fair launch auction where participants can contribute capital and then everyone gets the same price. Typically, DeSci up to date has not operated with kind of strong VC pre-sales. I think it's actually incredibly important for DeSci communities to kind of form bottom up and incentivize the community and scientists and people to join. And then the last step is that the protocol automatically deploys a liquidity pool on chain that fundamentally makes these DAOs tradable, discoverable, and public. So we have a whole lot of upcoming launches. These all just went live. So we have SpineDAO that we'll hear later from today, and then MycoDAO. MycoDAO just hit its minimum funding target of 2.2 thousand Sol. Spine is currently sitting at 1.4. And then increasingly, we're gonna list more and more of these communities also just in a discovery mode, so that people from all over the world are able to discover them, join their early communities. Yeah. So how can you actually think about Bio now in this broader context? So Bio really represents a growing portfolio of IP tokens that are backed by science. And fundamentally, we think of IP tokens, they are governance rights over a real-world asset. Fundamentally, this IP is going to become valuable. Not all of it, that's the nature of science. But I think one reason why I'm extremely bullish on this type of scientific or product development is because it's so close to the users. And so this is an example of VitaDAO's current IP portfolio. Again, it's set at about 40 million, I think, at the end of last year. It's currently sitting at 8, kind of in line with how the markets come down. And we're actually going to talk a little bit about one of the IPTs that are in this portfolio and kind of how this works. So this is a typical innovation cycle within a company. So if you've ever studied innovation or kind of how scientific discovery works, typically there are a lot of ideas that get bounced around, and then eventually they end up in a funnel and they get taken to market. But you end up with a lot of things initially and then narrow it down. Now, if you think about science or you think about specific diseases, like discovering a cure for cancer, you have to imagine that across the world, there are hundreds of companies doing this process in silos without sharing much information with each other or collaborating to cure the same diseases. And that is I think that's a fundamental inefficiency of our modern times that we've somehow created. It's a result of the current patent system that we have that really incentivizes monopolies, and it disincentivizes information sharing and kind of open science. I talked about this at the beginning of kind of the talk. My hope fundamentally with DeSci and crypto is that we can actually move into a post-patent system, right? Where innovation can be kind of discovered and worked on and collaborated on at a much, much faster rate. Because imagine this process should be happening globally, not in silos all over the world. No wonder it takes 10 years to discover a drug and it costs upwards of 1.2 billion if everyone is running the same really expensive process. Yeah, so currently DeSci really focuses on this part, kind of early stage discovery and preclinical, but Long COVID Labs is essentially taking something into humans in a phase 1, and with several other DAOs, we're in discussions actually for phase 1 trials or for first in human trials. And what's fundamentally going to move DeSci forward? What will people remember? It's once we start having, I think, in human trials and outputs. So fundamentally, a last little building block for anyone that's new to DeSci, there's a fundamental innovation that we've developed at Molecule, which is called an IP-NFT. Most of the DAOs that you see in the bio ecosystem are all using kind of the IP-NFT as a fundamental framework to secure innovation on chain. And an IP-NFT is actually pretty simple. It's a legal contract that is typically a one-of-one relationship. Let's say Ethan works at a university and I want to fund Ethan's work. I will have a one-to-one relationship with the university, and the university will say, cool, you own 90% and Ethan still owns 10%, or vice versa. And so it's a real-world legal contract. We work with some of the best IP attorneys. Then it's a smart contract that essentially structures the NFT and any kind of additional tokens that are created around it. And then fundamentally, it's a encryption and data storage system. So there's data that is not publicly revealed to anyone, but then there's selective disclosure on the other type of information that you want to reveal. And this essentially creates almost a form of a trade secret. This entire bundle, for novel IP, you can now transfer within a minute, depending how fast the Ethereum blockchain is. And that is a fundamental, that's a fundamental change in IP innovation. IP-NFTs can further be fractionalized, and we'll look at an example of that just now. So you can take an individual IP-NFT, and then we can create a governance wrapper around that. Now, what does that do? That enables contributions for individual work, so I can now pay people in little chunks of the IP. I can incentivize them in a different way, and fundamentally govern the asset in a public fashion. So IP-NFTs can be exchanged for work, for funding, additional funding, or for contributions. This is really interesting, for example, for DAOs that have an IP-NFT that now want to raise follow-on funding for one specific research project, or allow a broader community of people to participate in that asset. I'll give a last little case study. One of our leading assets is VitaRNA. And so VitaRNA was actually an asset that, a project that was introduced by Pfizer when Pfizer invested into VitaDAO. And this is essentially a tokenized mRNA-based gene therapy. It was first funded for roughly 90,000 by the DAO in May 2023. And the incredible thing here is, you have to imagine, the DAO bought this IP for $90,000. That was the cost. And then there was a follow-on tokenization. Whoops. There was a follow-on tokenization. Sorry about that. There was a follow-on tokenization that raised 300K in June last year, roughly. And after that, the asset began publicly trading. So for 300K, the asset was priced at 1.5 million FTV. And then it began publicly trading. It stabilized at roughly 3 million FTV. And then the community and the scientists did a series of data drops. And so we could kind of see live with each consecutive data drop, the community got more and more excited about it. And the researcher, Michael Torres, is actually also coming to Dubai this week. He couldn't make it, but we're really excited. We're doing a first meeting with the Abu Dhabi health regulator to explore whether a clinical trial for this asset could be feasible in Abu Dhabi, which would be huge. It's currently trading at around 8 million FTV. I think at its height, it was almost 35. And I think it's a really powerful, like, here you have like live data getting published and the community really kind of responding to that. Fundamentally, we see, I need to wrap it up, hey? Yeah, fundamentally, we see this all as kind of like an open liquid market for scientific innovation that's emerging. Kevin is gonna share a little bit more about that. And with that, should I wrap it up? Yeah, cool. Oh, I'll say one last thing. We're building towards a world where scientists spend 80% doing the science and 20% applying for funding, and where anyone in the world can fund and participate in science independent of institution and geography. Cool. All good?